we can certainly be the eyes and ears to what our symptoms are and what our loved ones' symptoms are. One of the biggest things that you're going to hear out there that healthcare providers are promoting is something called flatten the curve. And what we're trying to do is, it sounds counterintuitive, but we want the virus to move more slowly through the population so that we don't overwhelm our health services. We only have so many hospital beds, and so all the things that you've been told, washing your hands, social distancing, protective, isolating yourself, say if you're like me and you're over 60, if you have a lung disease, you're not going to be going out in public. We're going to use other people to come bring us our groceries. We're going to stay away from gatherings. And we're so thankful for those in our family who are able to go still navigate those areas and help us out in that way. So the best way to take care of grandma, like you presented, now that grandma's already sick, but the best way to take care of her is to prevent her from getting sick. The old prevention is the best medicine. So that's the biggest thing, is to protect them. You don't want to go visit grandma if she's in a nursing home. It's probably best if you don't go visit her in person, that instead you make phone calls. That, maybe you can set up something technology-wise and help her do video chats to stay in touch. And I would call your older family members, like your moms and stuff, just call them regularly. Let them know they can call you. Be accessible to them. And people in your age group, Jeff, are kind of in the squeeze situation because their kids are home from school because the schools are closed, and now you're going to be running around getting groceries for mom, and yeah. But we appreciate it.
Nice.
So what if a family member is ill? Well, if they live away from you, you still don't want to be going over there unless you're in a situation where they're living alone and you have to step in and be their caregiver. And that's going to be a decision you make on your own. And what you need to know is that you are putting yourself at risk of contracting the disease, but likely if you're in your 30s, you're less at risk of the serious complications than grandma at 80. But until you need to do that, I would call, if they're sick, I would tell them to call their doctor and notify the doctor. Then I would call them once or twice a day, monitor how they're doing. And if you start getting concerned that they need to be seen by the hospital or need to be seen to make a decision whether they need to go, you might need to step up and just do it. And if you end up having to step up and be their caregiver, you're going to be stuck in the house with them, just like they're stuck in the house. So just be aware of that. If they already live with you, what they're saying, and you'll have to do this if you go over there and become the caregiver, they're saying that you need to set them up in a separate bedroom, preferably with a separate bathroom. And you want to be wiping down your regularly used things like light switches and door handles and surfaces. They even talk about using face masks and gloves, but yet I'm not sure how accessible those things really are to a layperson. And if you don't have an actual diagnosis, because they may have the flu, but you just don't know, you might have to just do the best you can and wash your hands after you do things like wipe the counter or handle something. You could, if they're really hacking, there's lots of stuff. You could take some sort of like a bandana and put it over your face. If you're afraid that you're going in the room and they might, cough or sneeze on you, and then wash the bandana afterwards. So have more than one, and wash your hands after that. The other thing is to keep visitors away, and those are the biggest things for taking care of them. Oh, monitor the other thing is to monitor their symptoms. Especially as the age goes up, you want to make sure they're not getting into a situation where they need emergency care.
Okay. How would you know that they need emergency care?
Well, now this is not a comprehensive list, but this again came from the CDC. Mm-hmm. And it pretty much just makes sense. If they're having difficulty breathing, if they're having shortness of breath, persistent pain or pressure in the chest, new confusion, inability to arouse, hopefully you would catch it before then. If they're just kind of being floppy and they're not responding well, hopefully you'll get them before they get to the point of inability to arouse. And if you see color change around their lips or in their face, that's a 911 call. Okay. And on the difficulty breathing, there's a whole gamut of that. And some of that is a 911 call too. You're going to have to use your best judgment.
There is one question that is like, and I think you answered it, but you could repeat it too. What do you do if you're living with someone that's diagnosed?
If you're living with someone that's diagnosed and you're hoping you won't get it, you want to isolate that person in their own bedroom and hopefully their own bathroom. Mm-hmm. So you're basically setting up an isolation room in your home. If you've ever seen an isolation room in the hospital where people dress up in the gown and gloves and a mask before they go in the room, and then they take it all off. That's kind of the premise in your head that you're doing to the best of your ability in your house. And much of it, you won't have the tools to do a full job of that. And a lot of times these people aren't needing to be in the hospital, but you can at least wipe often used surfaces. You have a liner in their garbage can. You go in and you take that garbage straight out to the garbage can. You wash your hands thoroughly afterwards. You don't touch anything around your face if your hands have touched something dirty. And that's the biggest thing about not touching your face. You don't want to be touching your face if you've touched something that could be potentially dirty.
If we are having symptoms, is it like, a scratchy throat, those kinds of things? Like, is it important to go to the doctor immediately, or is it like, what should we do? Should we wait?
You don't have to actually physically go to the doctor, and they actually are preferring that you don't, because the doctor's offices are going to be quite busy. And what the basic symptoms of the COVID-19 virus are, scratchy throat, dry hacking cough, body aches, fever, but you can have some or all of those. You don't have to have all of them for it to be that. But guess what? That's just like having a really bad cold or a flu when it starts out. And so what you might want to do if you have a little bit of a scratchy throat and you have allergies maybe it's just allergies, I'll drink some fluid, I'll see how I feel, and maybe don't go out and see other people. And then you're kind of going, yeah, this is, I'm getting sick. Well, if it's 10 o'clock at night or 3 o'clock in the morning, you don't need to call the doctor. But in the morning, when the doctor's office is open, call your primary care provider and let them know that you have the beginning symptoms. And a lot of the doctor's offices will request that you call them back if your symptoms get worse, and they may give you some of these same guidelines about maybe going ahead and isolating yourself from the family, or from, or self-isolating in your house, just to make sure we're protecting our community.
Does anyone
Okay.
know how many actual test kits there are that are available? Like, who's actually getting tested and diagnosed for real? Does anybody know that? Because from what I've heard, there aren't any.
There are test
They're
kits.
not good ones.
There are not enough.
Right. So how many people are actually getting diagnosed for real?
The ones that are probably getting diagnosed are in the hospital system, most likely.
Right.
One example is a nurse friend of mine. Her daughter is showing symptoms. So what they did, because they didn't have test kits in the clinic, they tested her daughter, who's like, I don't know, 9 or 10, for flu A and flu B and something called RSV, which is a really nasty upper respiratory infection. And she was negative for all 3 of those. So then the next place the physician's brains will probably go, she can't be officially diagnosed with it, but she very likely has it. And so this nurse is not going to work. The whole family's isolating themselves. They're following all the CDC guidelines. And that's about the best we can do right now, unfortunately. What you are going to see is the numbers that we have right now. What they are saying is that those numbers will skyrocket sometime during the next week, this week. And the reason they will skyrocket is they finally are releasing criteria to be able to test more people, which means we're going to have more positives. So the numbers that you see right now are pretty significantly under what the numbers really are.
Yep. Sucks.
Right.
And that's all we can do. But that's the good thing, is that we have all sorts of different ways of taking care of things. That's like, if you don't have a mask, you can put a bandana around your face if you're taking care of somebody in the home. It
has to do with how long people need to be isolating themselves, or social distancing, and how completely do they need to social distance. Like, depends on your age, I suppose, but can you go to the grocery store if you wash your hands afterwards, things like that?
People are going to go to the grocery store. What a lot of the grocery stores are doing right now, they either have the Clorox wipes already there for you to wipe the handle of your grocery cart, or they even sometimes have people that are wiping the handles for you and pushing the cart toward you. So if you have to go to the grocery store, go when it's not going to be so busy, which right now it's kooky time because people are buying everything off the shelves. And then use the hand sanitizer, which there are recipes for. You don't have to just buy it if it's out. And, stay away from people, 6 feet away if you can, and get in and get out. How long? If you think you were exposed, what they're saying is that you could get symptoms between 2 days and 14 days. And that's their best guess with the info they have also. The most common thing is that if you did contract it, it's going to come on about between 4 and 5 days or so, you'll get sick. That's the typical. But you can get sick up to 14 days after exposure.
Okay, specifically, I want to know, but this is a personal issue. I can't see my grandchildren. I normally take care of them.
Mm-hmm.
their parents are having to take care of them and be away from work and their other responsibilities. Can I see them?
You know, it is your choice to do what you're going to do, what is best for your family. You know, Janie, I happen to know, because I'm related to you, that you that you're a very healthy person, and that, you know, what was I going to say? I was going to say something, and now it's just left my brain.
Well, I can't keep from smooching them. That's the one thing for sure.
Yeah, you'll have to stop that. Oh, I know what it was. It was the fact that the reason you're isolating yourself is because of your age. Okay?
Mm-hmm.
So what you can do is make a personal decision to increase your risk by taking care of your grandchildren, who I hope they're probably not going to any of their little music classes. They're probably not going to any preschool stuff. And, you know, your daughter and her partner are probably taking really good care not to infect themselves. And just be aware of what your risk factors are. But that is a personal choice of yours.
Okay.
Yeah.
Thank you.
This is going to be for a long haul. So, I mean, they're talking 2 months. And so you've got to kind of look at, what can I do and what can't I do? What is my risk factor and what isn't my risk factor? And just kind of put all the pieces together for yourself.
You know, you got the picture, and so do I, but it's the risk thing gets exponentially larger the more people involved. And so,
Correct.
yeah. So
Yeah.
if it's just the children and I don't see the parents, and they keep their house clean, or I bring the children here where I'm keeping it clean, I could maybe just take care of them here, and then it's just between them and us. And if they're not exposed to other children or other families, that's probably fairly safe.
Right, exactly. The unfortunate thing is, children, and especially them, they're not going to keep their hands off their face and in their mouth, out of their mouth. And so, you know, not having them with other children that might be infected is going to be big. And then the other thing is that they are little vectors. And so they may have a subclinical course.
Right.
Or just a little bit of sniffles that you didn't even chalk up to an illness. So yeah, you're just going to have to, you know, wash your own hands really well when you wipe their noses and that kind of thing.
Okay.
Are they expecting more test kits to be coming?
That is what I heard. I heard that there are more test kits, and that that FDA has released, or whoever it is that has to make these rules, has decreased the stringency of who they can test.
I have so it's similar to the last question, but kind of reversed. I have a 25-year-old son who, in this millennial ego space of like, oh, I'm not going to get sick. This isn't about me, right? So as of last night, he was going to the gym, going to bars, hanging out with his friends, right? Doing all the things that, as the mom was suggesting, that, you know, he needs to be safe to protect other people, not just about him. So now I think they've closed the bars, they've closed the gyms, he doesn't have a choice. But,
yeah.
Right. And so I've been kind of in my bubble here for like the last 5 days, and, you know, doing my part to keep the community safe, right? And to protect our medical system, because I have a nurse at Evergreen, right? And it's a disaster. And so, but my question is, since he's been out in the world like this, do I allow him to come over?
Again, it's like with Janie, that is your choice, but you've got a high risk of getting it.
Yeah, right.
And I think that with your 25-year-old son, your risk is higher than what hers were when she already knows what her daughter and her daughter's partner are doing to protect themselves, and that the twins are not intermixing with other children.
Yeah.
So, and you just have to make your own personal decision, because that's what people are going to do.
Right.
If it were me, I wouldn't I wouldn't have him come over. I mean, I'd call him and talk to him like this, but
yeah. Well, I told him today, I said, if you want to come over for dinner, we can go sit outside on the deck, right? And you can sit 6 feet away from me, but you can't touch anything. So how much, make him kind of do his own social distancing for 14 days before he can?
Yeah. If he's willing to do it.
Yeah.
See that? Yeah.
Yeah.
And he is 25. I mean, it's not like he's 17. I mean, you might have to be more of a mother for a 17-year-old.
Yeah.
But he's 25, and he's going to do what he's going to do.
Yeah.
But to be without his mother's arms around him, etc., I think he can tolerate it at that age. A lot of kids have gone through college by then, and they had to be away for months. This is going to be at least a 2-month-long thing, and who knows how it will progress.
Mm-hmm, mm-hmm. You mean 2 months of social distancing, do you think?
Yeah.
So yeah, what he said was how important the social distancing is for the long term, because I asked, I was like, it's kind of scary to say, I'm gonna have this distance from work or school or my family. That's scary. And he's like, well, what's kind of scarier is not doing it.
Right.
That's why the government has put into these social distancing, put that in place, is so that the effect actually so that we can follow the lead of Hong Kong or Korea, who haven't had very many deaths. And
exactly. Yeah, exactly. We want to be like them and not like what happened in Italy. Right. Mm-hmm. And if not, I have one thing I wanted to mention. This isn't from the US, CDC, FDA, da-da-da-da-da. However, it has just come out from the French Medical Authority, and they are way ahead of us in this disease and what they've seen. And the guy that's head of this is a physician as well. And what they have seen is that anti-inflammatory medications, which include corticosteroids, which some people take, say if they have a real bad asthma attack, or non-steroidal anti-inflammatories, which are over the counter, like ibuprofen, brand names, Advil, Motrin, or naproxen sodium, like naproxen. And also aspirin is a non-steroidal anti-inflammatory. What they've discovered is that seems to make this disease have more problems for your body. And as moms, for those and some, I suppose dads too, a lot of times when your child was sick, the pediatrician will say, but only give them Tylenol for fevers over 102. The fever actually helps fight off this virus. That's your body's mechanism for doing it. Now, if your fever gets really high, you're going to need to go to the hospital. If you're going to 104 and above, 104 if we're an adult, you need to go see the hospital. But kids will run a little bit higher temperatures, but you still want to really watch things when it gets into that range. But stay away from those type of non-steroidal anti-inflammatory drugs for now, because it looks like it actually can harm you. We don't know about the Tylenol. Tylenol is not an anti-inflammatory, but let the fever do its work and don't immediately treat the fever is what I would suggest. And like I said, this is all cutting edge new stuff from another country. I don't have like CDC backing on it. So I would then also refer you to your physician about these questions, and don't just take me as, or anything. And the other thing is, I would say, if you're on aspirin regularly from your doctor, or if you're on some other prednisone regularly from your doctor because of asthma and those things, you keep taking them. Don't stop. I'm talking about somebody who doesn't have a situation like that isn't taking those meds, starting to take those. It would be better if you would take Tylenol instead, most likely. And I say most likely because this is all new, cutting edge stuff. They haven't had time to do really big studies.
Are you saying about ibuprofen too?
Mm-hmm.
Okay.
Yeah.
And do they, should we be, what is the CDC website? And should we be checking it regularly?
If you would like to, you may. It's a great resource. You can find all sorts of information. It's cdc.gov.
Perfect.
Yeah, and the one thing that I'm sharing with you about the anti-inflammatories, it's not a peer-reviewed paper or anything like this. It's coming out of France from their health authority. Okay. And so just letting you know that your doctor supersedes anything I would say in that regard.
Great. So for grandma, I want to protect grandma, number one. Number two, we want to encourage the social distancing, all of the preventative measures, washing hands, and if we are going to connect with these people, we want to have them maybe in a separate bathroom, separate bedroom, and be able to really monitor the cleanliness of their environment.
Yeah.
So that we can create as much as we can a difference from our environment to theirs. Is that about right?
Yeah. Mm-hmm.
Okay. And let's see. And if they're running in, if the symptoms are dire, go to the hospital.
Go to the hospital. And, most anybody knows when their body is getting into trouble, and this is more than something you can take care of yourself at home. Go to the hospital. And if you have any questions, call your doctor. But even when you call your primary care provider, on that voicemail they say, if this is an emergency, go to the call 911. So use your brain. Obviously, if people are having trouble breathing and there's blueness, they aren't getting enough oxygen, and somebody needs to act really fast. And so that's 911, or even if they're having trouble breathing and they're breathing fast and they're using all their extra muscles to breathe, they probably need to be seen by someone in the hospital.
Okay. And there's another question here that says, if grandma lives alone, should she limit contact with personal drivers, or would it be better for her to have things delivered?
I would say have things delivered. Are you talking about grandma who is sick or grandma who is well?
Grandma who's well, but at a risk.
Yes. Yeah. I think it would be better to have things delivered. If that's not possible, you'd have to do the driver. But
Any other final comments or questions, Shay?
I think we hit everything. The only thing, just letting you know that there are There are recipes for both a diluted bleach solution and a hand sanitizer on the CDC website. So, you know, you have access, and I actually ordered some of it from Amazon. I ordered the alcohol and the aloe vera gel from Amazon. They're not out, so you can make your own very easily. But it's always best to do soap and water if you're at home and you've got access to that. The bleach solution, of course, is good for cleaning your surfaces, your diluted bleach solution.
Well, I want to thank you so much, everyone, for attending this. I hope that this dispelled any rumors and allowed for you to feel a little bit safer and more able to handle this kind of wild time that we're in. I'm really enjoying this ability to kind of communicate and connect with each other. To get out this information that kind of can be overwhelming in the media. All right. Well, thank you so much, everyone, for attending. And thank you so much, Shannon Damitz, for giving us all of your information today. All right. Thanks so much. Bye, everyone.
Bye.